Right, thank you, Ellie. Hello and welcome everyone. My name's Liz. I'm one of the helpline advisors. I work on the email advice line. One of my specialisms is welfare benefits, but I also help answer queries to do with general caring related inquiries and just general funding. I have experience of being a working carer myself. So today's session is a little bit all about how we can, let me just move that forward, juggle work and care. So I know some of you might already be aware of some rights that you might have and some things that you may need to consider and think about. So today I'm going to just really hone in and focus very much on if you're a working carer and the help and support that you can get within your role, within your organisation, but also within your caring role as well. So let me just try and say that if you're trying to juggle caring with paid employment, you really are not alone. There is an estimated 7.7 million working carers. So that could be as many as 1 in 5 employees. That's current figures now, that's an estimation. What we do know is that pre-coronavirus outbreak, there was definitely 1 in 7 of all workers were juggling work and care. These stats were taken from the census back in 2011. So prior to the coronavirus outbreak, 1 in 7 of us were working and juggling care. And now that estimate has increased. So it could be as much as many as 1 in 5 employees. So it would be no surprise at all if you're feeling under additional pressure, if you're feeling stressed because of your caring role, and if because of that you have extra needs that need to be considered. One thing that I would say is that it's completely up to you whether you tell your employer about your caring responsibilities. You may prefer not to. That's completely understandable. However, if you do tell them, they are going to be much better placed to understand the pressures that you may be feeling, and they'll also be able to help you access any support that they could provide as an organisation. Some companies have carers policies, for example, or workplace carer support groups that you maybe could join. And because of this, I'm going to suggest that you think about whether you want to acknowledge your caring role and share that acknowledgement with your employer. Ask what support they have. Look in your staff handbook, maybe their intranet. Speak with your line manager or maybe human resources, depending on the size and type of organisation you work with. Think about what help you would actually need. It could be something really simple and easy that an employer could arrange just at the drop of a hat. So for example, if you wanted to phone home and check, is there going to be access to a private room so you could make calls? Could it be that you need to have your mobile phone on, maybe silent or vibrate, just have it in your pocket, just in case, just in case there's an emergency or something that you need to be immediately accessible for. So it's always worth just thinking about how that can be communicated to your employer. One of the things that I really just want to talk about is what your rights are. It's all about Carers Rights Day today, isn't it? So we're going to focus very much on your employment rights. So as you may know already, so hopefully you do know that you do have rights as a carer who is employed, and your rights come from 2 sources. So the law gives you statutory rights, which everyone has, and your contract of employment can give you what's called contractual rights. Now, these contractual rights can be more generous than statutory rights. So it's worth looking at what your contract says. What is the caring policy of your organisation? Does your organisation have a caring policy? Think about what you need and then look to see whether it's a statutory right or if it's a contractual right. Today, this session is going to focus very much about your statutory rights as a working carer, but as mentioned, it's always worth just checking if there's any extra rights that your company offers you over and above your statutory rights. As always with my session, sorry I forgot to mention it, but Ellie did mention it. If you want to pop any questions in the chat box, or maybe get in touch with the advice line after this session if something's popped up that you would like clarification on, please feel free to get in touch with us. So let's start to think about these statutory rights in more detail. So the first statutory right, and one that might be most beneficial to a lot of carers, is the right to request something called flexible working. So flexible working is the name given to any type of working pattern which is different from your existing one, or maybe the one that you were employed to do. So for example, you might be employed to work 5 days a week, Monday to Friday, 9 till 5. What you might like to do is make a change or request to change that working pattern to be a little bit more flexible, to allow you to take your children to school maybe, or pick your children up from school, work late one night, start early one night. Just some examples. I'll look at some more examples in just a moment. Now, currently all employees have a right to request flexible working after they have worked for the same employer for 26 weeks, which is 6 months. So if you've worked for your employer for 6 months, you've been contracted to do your Monday to Friday 9 till 5, and actually it's not working as good as it could be for you. You have a right to request this flexible working, change of circumstances, to be applied to your job role. Couple of things you need to know. You can only make one request every 12 months. And we would always advise that any flexible working request is made in writing, and it should include details of your current circumstances and also any details of the revised working pattern you are seeking. So when you think about the changes that you would need, if you can also try and put your employer's hat on as well. So think about how would this affect your employer's business. Try and counter argue any potential arguments that your employer may come back with so that your request is successful. Your employers must have a sound business reason for rejecting any request. They cannot just be, what's the word I'm thinking of, refused, carte blanche. You know, they have to show the reasons why what you are proposing would not work. Hence why it's important that you think about this and show how it could work. Only one request is allowed in a year. So key points there are in writing. Think about what it is you're asking. Look to see any potential counter arguments your employer could put against your proposal. And just remember that your employer is bound as well to make sure that they can demonstrate a sound business reason for rejecting this. So examples of flexible working. One that's very common now, and one that we think of a lot more, especially since we were all told to work from home. So now flexible working arrangements, working from home or remote working for part or all of the time. If you can show that you have been able to do your job successfully over the last year, it's a really good time to think about maybe making that request. Think about changing from full-time to part-time work. If this is something that you are considering, this would come under a flexible working arrangement. Changing the hours that you work, so maybe from weekends to weekdays and vice versa. What I just mentioned, changing working hours to fit in with school hours or college hours or maybe care arrangements. Now there's some really interesting and there's some good trials that are happening in other countries. So this is something called compressed hours. So that is, you do 5 days work, but you do it in fewer days. So maybe in 4 days. It does have some pitfalls. So you would work longer hours over those 4 days, which could have difficulties associated with care, for example, but it means that you have that extra day a week free. Maybe that's something friends and family could help you and support you with. And there's been some very positive trials, and I think it was maybe Iceland and in some European countries that are showing that actually it has a positive effect on people's well-being. It doesn't cause any loss of productivity, and generally more was getting done rather than less. The last one, which is really common, is a flexi time, which allows you to fit your working hours around agreed core times. So this could be, instead of working 9 till 5, your employer actually is really happy if you, as long as you're in the office between 10:30 and 2:30, say, because this is the busiest time, they might be agreeable to you starting at 10:30 and finishing at 6:30, or starting at 7:30 and finishing at 3:00, for example. So as long as you've got your core hours covered, they could be really, flexible in terms of shifts and things like that. Right, time off in lieu is another one. I haven't put it on the slide, but sometimes the employers can be agreeable to a time off in lieu system. So if you find yourself having to come in work late or having to stay late, they agree to give you that time back or count any time you've got in the bank towards that time. What I would just say on this point is if asking for a flexible working request is something that you're thinking about, to help you provide that counter argument, that's something that we could help you with on the advice line. So you could get in touch with us, or maybe you could get in touch with ACAS, have a look, Citizens Advice or another organisation, that can help you. Because actually being able to work in a way that is the best for you to allow you to provide that care and support that you need to provide is absolutely key to be able to do this. I'm just having a look to see if there's any quick questions. I can't see any, so we'll just move on. Now, if you remember on the last slide, I said, currently you need to be working for your employer for 26 weeks, which is 6 months, before you can make a request for flexible working. Now, you may remember that the government did a consultation on carers leave that was launched in 2020. And what they were looking at was quite broad things, but they considered, and in recognition of the need to provide better support to working carers, one thing that they announced in September 2021 was that working carers will have the right to a week's unpaid leave and the ability to request flexible working from the moment they start their employment. So you won't need to wait 6 months to ask. You can try a working shift pattern, say for a week, 2 weeks, maybe a month. And if it's not working, you have the right to ask for that. Now, this is a really good step forward. However, and there's always a however, isn't there? There's always a but. In order for this legislation to be finalised, the government has said that the legislation to introduce the new leave rights will be brought in when parliamentary time allows. So it's waiting for a slot to be heard. So as yet, we do not know when these changes will be implemented. We do know that it is going to happen, and it is a really good step forward. So we just need to watch this space and see when that actually gets heard. I've heard unofficially on the grapevine it should be sometime in the new year, but I can't commit to that, so you'll just have to take that as we heard it on the grapevine, it might be. Okay. All right. Let me just check. Should I come back to questions at the end?
Please, this is Ellie. There's one comment on the chat which I can read to you. Neil is saying, flexible working slide. I speak to my line manager and store manager. They change my shifts, but when it extends to another 4 weeks, the one who changes my hours keeps saying they lost the information. So thanks, Neil, for adding that to the chat. And Jane is asking, will these changes be made across all nations?
That's an interesting one, Jane. I'm going to have to come back to you on that one. As far as I know, I'm going to come back in case I say something that leads us astray. So what we'll do is when we send the notes out, we'll just add a little bit to let you know that. In terms of your flexible working, Neil, what can I say? That's really not good. It might be something that you want to maybe have a discussion around, maybe not as far as raising a grievance, but almost raising it as a point to make sure that everyone's aware of the situation and there's a note, whoever does the rota. I would definitely look at taking some separate advice on that issue, if I'm perfectly honest. because it's not great. Maybe keep a record of how often it's happening, and if there is a particular pattern developing from the information that you're providing, I think there potentially is. You might want to, like I say, look at it a little bit further, maybe raising a grievance, just because one of the first steps in protecting yourself from discrimination. And now this is a statutory right, and this actually might help answer your question, Neil, and it might just give you a little bit more confidence in addressing this issue with your employer. So in England, Wales and Scotland, if you're looking after someone who is elderly or disabled, or meets the definition of disabled under the Equality Act, the law known as the Equality Act 2010 will be a protection for you against direct discrimination or harassment because of your caring responsibilities. Now, this is because you are counted as being associated with someone who is protected by the protected characteristic of being disabled or because of their age. So this is really important to think about. So examples of discrimination by association, and it's a bit of a mouthful, I know. So for example, an employer refuses to offer you a job once they find out you have caring responsibilities. Okay, they can't do that. As a carer of someone who is disabled, you have protection against being treated less favourably. So they can't not offer you a job once they know of your caring responsibilities. They can't treat you less favourably either. You're also protected outside of work from acts of discrimination. So not only in the workplace, but I think this is so important that we realise that actually we do have protection. So if you are discouraged from using a service because you care for someone who is disabled, again, you would be protected. Finding it impossible to use a facility because you look after someone who is disabled. Now, if you feel that you are being treated less favourably because of your caring responsibilities, then you should seek expert advice. I mean, discrimination, it is a very, very important topic. It's one that is missed because actually people don't always realise that there is protection. Now, the Equality Act 2010, as I mentioned, it covers and supports people in England, Wales and Scotland. Now, if you're in Northern Ireland, and I know a lot of our carers are in Northern Ireland, your rights as a carer are protected under the Human Rights Act and Section 75 of the Northern Ireland Act. So, as you can tell from my accent, I'm not in Northern Ireland, but it's really important to know that you also have rights. So these acts require public bodies to promote equality of opportunity for carers. So in some cases, carers could have rights under disability and sex discrimination legislation. So if you live in Northern Ireland and feel again that you have been treated less favourably, or when you were made your employer aware that you were a carer, they suddenly changed direction, maybe you feel you were passed over for a promotion, there was no flexibility in your working day allowed, contact, and we have a Northern Ireland Carers UK Helpline that you can ring, or you can contact advice@carersni.org for expert advice. Slightly different, you can contact us as well, and we can help answer your question. If it's more specialised, we do have colleagues over there that are able to help you. So it's a bit of a tricky one, and it's a huge topic, to be honest. I could do a whole session in itself on discrimination, but I just wanted to let you know that actually if you are providing care and support to someone, that although you yourself may not have a protected characteristic, you too could have a long-term disability or health condition, that by providing that care and support to someone, then you have protection as well, and it's called discrimination by association. Okay, right. I can see there's some questions, but I will come to them at the end. The next statutory right you're entitled to. So, and this is where it gets a little bit confusing and a little bit unjust and unfair, shall we say. But let's look at it practically. So you have the right to time off in an emergency situation. So all employees have the right to take a reasonable amount of time off work to deal with an emergency or an unforeseen matter involving a dependent. So a dependent, so this could be your partner, child or parent, or someone living with you as part of your family. It could be the person that you are providing care and support to. So it could be a grandparent or a neighbour or a friend. Okay, but you have to be their main source of support, and it has to be an emergency situation. Now, this time off is unpaid. It's statutorily, that's under statute, it's unpaid, unless your employer has something in your contract or your handbook or your carers policy that allows for this time. An emergency, or maybe compassionate leave, it could be called, would be a contractual right, and then you might get paid for it. But under statute, your time off, you are absolutely entitled to have it, okay, if it's an emergency situation. And emergency situations are things like a disruption or breakdown in care arrangements, the death of a dependent, for example, if a dependent falls ill or is in an accident, if you need to make longer term arrangements for a dependent who is ill or injured, but not to provide long-term care yourself for that person. So maybe somebody's had a fall, broken a hip or something like that, it's going to be discharged from hospital, might not be the person that you normally care for, however they are dependent on you. Could be an older parent, for example. You're not going to be arranging and you're not going to be providing this long-term care yourself, however you need to organize it. You need to find out who is going to be involved. It could be an incident involving your child during school hours. I can remember my son used to get in some terrible scrapes at school, and they'll be like, oh, we think he just needs to see the doctor. He fell and bumped his head as a precautionary measure. So, you can't predict that, but your employer has to give you that time off. Okay, it is unpaid unless they have any provision to provide payment during those contracted hours. This last statutory right that we have. So this is the right to parental leave. So it might be something that some of us have not come across before. So if you have worked for the same employer for 12 months and you are responsible for a child under 18, you're entitled to 18 weeks leave per child. Okay, so we need to think in the terms of the lifespan of your child from being a tiny baby all the way up to 18. So these 18 weeks leave have to be taken by the child's 18th birthday. Now this time off is unpaid again, unless your employer is willing to give you this paid time as a contractual right. So you're entitled to the 18 weeks leave. You can take, there's a limit, I'm afraid. You can take parental leave, you can take 4 weeks in each year, unless your child is disabled, in which case there could be extenuating circumstances, or your employer agrees otherwise. There's also one other thing that we need to think about. You generally are encouraged to take your parental leave as whole weeks. So for example, 1 week or 2 weeks, rather than individual days here and there. It can get really messy if you're taking individual days here and there, especially when you consider it's a span of 18 years. It's your responsibility to keep a record of those 18 years, those 18 weeks over the 18 years. You don't have to take it all at once. But a week, it does equal the length of time that you would normally work over 7 days. Okay, so for example, if you worked 5 days a week, a week's leave, parental leave, would be the 5 days. Okay, if you normally work 2 days a week, then your week's parental leave would be 2 days, for example. So it's an interesting one, that. It's not one that a lot of people know. This isn't just to do with if you were caring for a disabled child, so it might be something you want to share with wider friends and family members. The right to parental leave is one that is engrossed in statute. So in summary, our statutory rights as a carer. So we've got the right to request flexible working. We've got the right to be protected from discrimination, the right to time off in emergencies, and the right to access parental leave. Now, you can read more about this on our website. And if you want to read a little bit more about some of the challenges that other people have faced and, you know, some of the stats and things like that to do with our 1 in 7 working carers I mentioned earlier on, there's a report that you can read. I've just linked it through from our website about juggling work and unpaid care. So I know I have covered a lot. Oh, and I've forgotten to click that. So I'm just going to click that on for you. There we go. So if you want to get in touch with any questions you may have, if you want to get in touch with me, if you mark them for attention of Liz, any of my colleagues will be able to answer your questions. They will come through to the right department. Don't worry. I work on email, so it's advice@carersuk.org. We have a telephone helpline. And of course, we've got our other methods of contact that you can find on social media.